Hi, I'm Dr. Knies at Rose Injectables. You're receiving this video because you've expressed interest in having FaceTite or BodyTite done, or you're just, wanting some more information, and we want to walk you through the process of how you prepare, what the treatment looks like, and that post-care so that you can be fully prepared. So BodyTite, FaceTite. Let's explain just a little bit about that technology. So this is bipolar radio frequency, but the way you want to think of it is it's a way for us to introduce energy and heat deeper below the surface at levels that we cannot achieve if we were just going to do it on the surface. And that's because when we deal with skin and at the top, we're worried about burning it if we get too hot, right? And so the important thing is if we can go underneath, we can bypass that and create bigger and better change. And the reason it's so popular is it's a way to limit big incisions, so you don't have to have big cuts that have to heal and big scars. You don't have to have drains. And a lot of times we don't need to have general anesthesia, but we can still create really, really great changes. So during things like COVID, a lot of these technologies that have been around for a long time got very popular very quickly because if you can imagine, the operating rooms are shut down and people are wanting big change, and they're also seeing things that in a different way and a different light that maybe they didn't before. So people are at home, they're on Zoom meetings, and they're seeing things and imperfections closer up on their skin, and they want big results but can't go to the operating room, or they don't want to. Sometimes you're also in the boat of, hey, I would really like this treated, but I just don't need surgery. I'm not ready for that. Or maybe you had surgery and you want to wait till you have to have another one. So these are amazing ways that we can create phenomenal change, better than anything else we've really seen before that doesn't require an operating room and can be very, very comfortable. So there are a lot of advantages of this for what we're able to do. And a lot of times it also comes with price savings from the standpoint of we're not taking you to the operating room and incurring a lot of expenses of things that aren't necessarily directly attributed to those treatments. So that's kind of background on these treatments and a little bit more on what that process looks like and how the treatment actually performs. So when we're doing BodyTite or FaceTite, a small opening needs to be made so that we can introduce the internal catheter. And that way we can actually heat internally and externally to be able to really iron out the skin. That's probably the best way to imagine it. So we want internal temperature, which can be much hotter. So a lot of times this is 68, 69 degrees Celsius versus on the surface, we tend to not get past 42 degrees Celsius. And internally, we can hear fat melting, we can notice contraction, and then you can see this tightening happen. So a good analogy here is going to be bacon. So when you put bacon into a hot pan and it starts to cook, it's going to tighten and contract. That same thing is what we call the fibroseptal network internally, and that's going to connect your deeper structures to the more superficial. So if you can imagine, you want to debulk an area. You don't want this double chin and fullness, right? Your options are liposuction or skin tightening or some other things. But what's really cool is with liposuction alone, you're limited in how far you can go because you aren't doing anything with the skin to tighten it. But when we introduce two forms of skin tightening like we do with FaceTite, it's a game changer on the results because now we can lipo what we want. We don't have to be cautious or limit how far we go. Then we can tighten everything down in two different ways and create beautiful, snatched, tight jawlines that don't require major surgery, big incisions, all of the things that we don't want to deal with. That's the process of what we're going to do. In office, awake, skin tightening, liposuction, and then another form of skin tightening to maximize those results. It's a one-time treatment, and you can plan to be in the office typically 3 to 5 hours. How that process works, so preparing to come in for the day. We will have you expose the area that's being treated. So if it's face, then we usually will switch you into a gown for the upper body because we're using a numbing solution and we just don't want to get anything on your clothes. Same thing if you're coming in for lower body or arms or back, we're going to usually remove the clothing from that area and give you disposable things so that we won't have anything in the way or anything that will get wet, anything like that during the procedure. So when you've made the decision that yes, this is the route you want to take, you do not want to do surgery, you don't want to go to the operating room, but you still want phenomenal results, then we would get a retainer from you to book the date for your procedure. Once we have that, we'll be able to secure that date and we'll block out a large portion of time and we will start putting together all of the treatment needs and devices that we'll use for the day and booking staff specific to this procedure. Then as we move forward about 2 weeks before your treatment, we usually will bring you in. We're gonna have you sign contracts. We're gonna review any questions you have and we'll collect the remainder of the balance. And we will just be excited to get ready to go for your procedure in a couple of weeks. If somehow there's a slight opening in the schedule and we're able to get you in because your time frame requires a shorter turnaround, in that case, we'll try to book you that day. And typically in that situation, we just collect full payment because we're going to get that process going very rapidly so that we can get you in and everything done as quickly as possible to get results faster for you. So we've got you booked 2 weeks or less before your procedure. We're going to go through and sign all of the consents. These are just to go through all the different scenarios and make sure you understand all the different aspects of the treatment. To note, if you're doing something like FaceTite, there's normal risks for any procedure that we do. So in general, anything that's going to create these big changes or surgery, things like that, it's going to be bleeding, pain, infection, damage to surrounding structures, needing to repeat the procedure. The unique part with FaceTite is that you do have a nerve in this area that runs more superficial called the marginal mandibular nerve. And we're not cutting anything on this treatment, but we are going in this area and sometimes that nerve can be irritated. So word of caution for you is if for some reason this area is fine and you're not worried about jowls, just let us know. We can happily avoid that area and mitigate that risk quite a bit. But if you do want to treat in this area, we can make an attempt to get as close as we can to help treat those areas and tighten the jowls in addition to the jawline and the neck. But there is a chance sometimes that nerve can be angry. We're not cutting anything, so all those things, nerve functions can come back, but I always do make sure everybody understands there is always a possibility something like that could be permanent. And so I want to make sure that you're aware of that. And please disclose any other treatments that you have had done to the area or surgery so we understand and can give you a better ability and knowledge of the true risk for yourself. So if you've had a Mohs surgery, if you've had PDO threads, if you've had cool sculpting, Kybella, any of those things, treating any of those areas or in that region that could affect the other nerves, we do want to know that as well. So we've got you set up. We're going to be doing this procedure. The day of, I recommend that you get up, have a little bit of breakfast. It's okay if you want to eat something that day. It's always important that you feel good coming in and you're not jittery. If you like coffee, that's great. If you drink coffee and you feel like you have to go to the restroom a lot because of that caffeine, then you may want to just hold back a little bit because during this procedure, we're going to have you all sterile. And so we won't be able to get you up to go to the restroom while we're in that sterile portion of the procedure. But don't worry, we always have lots of reminders for you to go to the bathroom before we get started too. So on preparation time frame, no makeup, no skincare, no lotions, anything like that, because we're going to take pictures of you on your arrival. So when you come in, we have various forms of photography that we utilize. With those, the number one thing that we'll use is just a regular camera. And that's because we want to get all different angles and sometimes motion, and we can't do that with some of our higher tech cameras that are measuring different things on the skin. Then from there, we're going to do Visia skin analysis photos. And so with Visia, that's going to give us a lot of different measurements, 8 different parameters of your skin so that we can track your progress over time. This is an incredible way that we can compare your skin to thousands of other women your age and give you data and feedback on your skin and what we notice. This includes percentiles and number of spots or texture issues or wrinkles in a certain area. And so that way we can actually show you improved results. I love to be able to say, you don't have to trust me. I can give you the data that shows those changes from a completely unbiased source to show you what is happening with your skin over time. And so we can see, hey, if you did a treatment today and you had 100 spots and next time you come in there's 50, and we can show you real wins. And of course you can see it on the skin as well. From there with Visia, we'll proceed and we'll do Vectra photos. Vectra is state-of-the-art technology, 3D recon camera that allows us to look 360 at a person at the area that we're going to treat. It also allows us to do a simulation of expectations for potential changes if you were to proceed with a treatment. So if you're seeing this and you're on the fence about FaceTite or something like that, I encourage you to come in. We can take Vectra photos for you, and then we can produce that simulation so you can get a better idea of what your profile, your face, and everything, and how amazing it could look if we did proceed with a treatment. So keep that in mind. So fast forward now, we've gotten photos. You are comfortably dressed in a robe, whatever we need for the procedure. We've just checked in with you, make sure you're doing okay. We're also going to schedule your follow-up appointments. Standard for us, just because I know sometimes this is a lot and it's something a lot of people have likely never done before, that sometimes questions arise. And so instead of you being at home or maybe your family members asking a bunch of questions and maybe you don't have answers to them, we do have frequently asked questions available to you, but we always love to see your results too. So we will schedule you to come in 1 day or 2 days after your treatment in order to just do a quick recheck and show you the progress of photos from the day of the procedure to the next. And then we will also schedule you for a 1-week visit. We'll schedule you for a 6-week and a 6-month recheck so that we can get photos for you. And we love to put these side by sides for you to showcase what beautiful results you have. So keep that in mind. We can also print those for you or send them to you electronically so that you'll have those where you can share or just watch your progress as it unfolds. Of course, if you love your photos and you want to share them with others, we always appreciate the opportunity to let others know of your success and how much you like the treatments, because that's how other people learn about these alternatives. Of course, this is kind of a grassroots effort, so anytime you're able to share and other people decide to come in is always amazing, and helping other women feel more confident is an amazing option that we have. So appointments are scheduled, you're all teed up. The next thing that we're going to do is we're going to mark the areas that are going to be treated. So we use a surgical marker and we're going to mark those areas. And really, this is where we want your input and your feedback. We want to make sure before we go in that we're all on the same page. I want to know, what is it you see that you want to treat? What are you noticing? Let's look in the mirror. Let's see all these things. And then we're going to mark those so that before we get started, everybody is clear that we can see what we want to do. Often I'll also take pictures then of those areas that we've marked so we can track them as well. We will check vital signs on you. We will check weight, so that way we just are maintaining, hey, how's your weight and stability on your weight over time? Of note, if you're someone actively losing weight, there are some areas of the body that can be impacted by this more than others, depending on your history. Say that you have fullness under the chin, and it doesn't matter what weight you are. You could gain, lose, it stays the same. In my situation, I always had the same fullness no matter what. I had it in baby photos, I had it as I got older, and so I knew if I fluctuated my weight, that wouldn't change. So I was a good candidate to have FaceTite done on myself at any point in time. But if somebody is losing weight and maybe they want to address their abdomen, it is important to be weight stable and not to fluctuate, because sometimes a 5-pound difference, depending on your height and your stature, can look very different in the results in the skin tightening or laxity. And so we always try to pay attention to that to make sure that the results that you get are the results that you want and can have a long-lasting effect, versus something that's more temporary in appearance because maybe we proceeded a little bit too quickly or too soon and you had plans of weight changes and things like that. Once everything from the preparation standpoint is completed, we will move you over to the treatment room. When you walk into the room, you will see a lot of blue, and everything blue is considered sterile. And so we will walk you through the process of having a seat, getting comfortable. We've got rests to put below your legs just to give you a little lift to make sure your back stays comfortable. We can cover you with blankets, keep you warm, whatever you need. And we always have the option, if you have favorite music you want to play, we can play that music in the office. We also have a TV available if you want to watch Netflix or whatever you would like. There's always options for little distractions. And if you're somebody who's very, very nervous about the treatment day, let us know when you come in. Sometimes we'll incorporate a little bit of nitrous or laughing gas just to kind of help ease you into the day as we get started. But I can tell you that these treatments are tolerated extremely well. And we have many patients that do these all the time with just local numbing to those areas and do fabulous. And then from a post-care standpoint, really Motrin, Tylenol, and maybe some Benadryl to help resting at night for a couple of days. So you're all set up, ready to go. We're going to go through the treatment. First, we're going to do local numbing right at that opening site where we're going to be using the cannula. Then we're going to set all these sterile drapes on you and the instruments that we'll be utilizing for the procedure. From there, we will go add additional numbing that's going to make things swell and fill, just so it creates a little bit more space for us, but it allows us to use numbing in a larger surface area. And this is how we get away with not requiring general anesthesia to create these massive changes and incredible results for patients. We'll do your numbing part, and then we will proceed with first introducing those catheters and just making sure that everything is moving fluidly through that space and that we don't have any resistance or adhesions or things like that in scar tissue. And that's why it is important for us to know if you've had prior procedures or treatments to the area, because that can sometimes preclude us from having successful results or being able to move through those areas, because things like Kybella, sometimes when we go in, can create almost like a cement formation in there. And times we can break through that and other times that we're not able to, just for the nature of some of those prior treatments. So please do let us know so we have full awareness ahead of time. So we'll go in, we'll loosen everything, and then the next step is going to be the FaceTite or BodyTite. So we're going to go in, we use ultrasound gel, and this should feel like heat if you feel anything. And we're going to go in and start that process of heating and melting fat, tightening that tissue, and really starting to contract everything down. We have internal temperature goals, external goals. Once those are achieved, we move on to the liposuction portion. If you're doing a under chin jawline contouring, just know there's never as much as what we feel like there should be in the collection jar, but the results are still amazing. So you can see what's removed, and that's how we know this is permanent. If we're doing liposuction and we take the fat out, it's not coming back. It's gone. It's in the trash. It's out of here. And so that's why I love these treatments, for that ability for us to create permanent and lasting change to the skin. And then we just look at maintenance options to maintain those over time. So we've done liposuction. Now we're going to move on and do our last form of skin tightening, and that's Morpheus 8. But before we proceed to that, what we'll do is keep everything sterile in the room. And because gravity is at play when you're laying flat, we're actually going to sit you up. This is a really important step in the process because it allows us to see the results when gravity is at play. Please understand, you're going to be a little bit swollen, you may be red, there's other things at play, but there's things specifically that we're looking for and feeling for when you're sitting up to know if we have made maximal changes to the area or if there's little areas for improvement. It's such a cool way to do this because you're awake, because of the way these treatments work, that we can really hone in and work that perfectionist level where we can go in and create that maximal change and the best results. So what happens is we keep everything sterile. I have a sterile marker, I stay sterile, and I will go look at the areas, we'll get pictures, I will mark anything I see, we will look at comparison photos from when you came in until that moment and see if we can identify anything else that needs special attention. And if we do, we mark that and we go back and we address it right away. And then once that's done, we're able to say, okay, this part of the procedure is done, and then we'll proceed with Morpheus 8 over the top of the skin. The beautiful thing is you're already going to be numb, so we can proceed with a wonderful aggressive treatment just to do the things that we need. And if there's areas of a little bit more baseline fullness, but maybe higher risk because of a nerve, we can adjust the settings to get that. So any of these things that are a concern to you, just let us know, because we're happy to tailor the treatment to you. And we have a lot of opportunity and options to do that with the devices that we carry. Once Morpheus 8 treatment is completed, we are going to take you back and we're going to take final photos for the day. And so we will get those same directions. We're going to have you moving around so we can catch all of the angles. And then after that, we have you get dressed, we'll check your vital signs again, and then we will apply a wrap. So for face, there's going to be a wrap that goes around your chin that needs to stay in place 24/7 for a week. And then I will recheck you at a week. Please wear that wrap coming into the office and for all that time before then. You are able to take it off for 10 minutes a day, but please understand the sharper results come from consistently wearing the wrap. I completely understand it's annoying and it can make your ears rub and sometimes uncomfortable, but the tricks here sometimes is to put a little bit of soft gauze around the ear to protect it, to soften it, and sometimes it's just adjusting it a little bit through the day. But the results speak for themselves when you wear it full-time 24/7. And if you aren't able to do that, please just let us know, because sometimes it will take longer for those results to come through if that area hasn't been compressed. Why that compression is important is when we do these treatments, your body's lymphatic system that drains away swelling or fluid are very thin-walled. So compared to a vein or an artery, they're much thinner. And when we go in with these instruments, they're very fragile and they're disrupted. So that ability to drain fluid or swelling off of the area goes away temporarily until those are able to rebuild. So it's our job to take that new space we've created by removing fat, and we do not want the body to then fill it with fluid as it naturally would, or blood. So we need to compress it to push everything out and keep that from happening. So that's why it's so imperative that we do this, and that it helps us to minimize complications or risk of seromas and other things like that. And so we do need your participation in this, and the results sometimes can be hinged on this participation of it that we do need your part in. We totally get that it's uncomfortable or awkward or things like that, but please know it's a short amount of time in the scheme of everything that we're going to be doing. So if it's abdomen or a different body area, we also look at ways to do compression in those areas as well. And so we will put compression wraps on you, things like that. We'll show you how to do it. Another thing you can do is, if you want to remember how everything looks, is take your camera when you're there and we can take a picture of you with everything in place so you know exactly how it should look if you're at home trying to do it on your own. But know that we bring you back at a day so we can answer questions, make sure everything is in the right spot, and help you so that we keep those results coming consistent all the way through so we can get captured with photos as well. Once all of those pictures are done, everything is ready, you are set to go for the day. You're able to drive yourself home. We aren't giving you any medications that limit your ability to operate a vehicle. If for any reason you feel lightheaded or nauseous or anything, which is not very common, but I do make sure you're aware, you're welcome to just hang out for a little bit. Or if you have somebody that you would like to pick you up, just let us know too. But know that you don't have to do that, and it's not expected, and most people don't need to.